One of the universal traits of a great practice is teamwork based upon cooperation and respect. Patients readily perceive low morale and friction within a practice. The brief interaction between Dr. Everett and Tim is especially damaging because patients and other staff could hear and observe it. Nothing does greater harm to the credibility of a practice than allowing patients and their family members to witness or to hear disharmony among physicians and staff. Tim was attempting to be friendly to Dr. Everett and to inform him that his patient, Mrs. Cooper, was ready to be seen. Dr. Everett was frustrated and unfortunately allowed his frustration to surface by raising his voice. His actions, in turn, will certainly have a negative impact upon Tim and other members of the staff who observed and heard the exchange. All behavior of the practice should demonstrate courtesy and respect. The interaction between Dr. Vasquez and her staff reflects a positive practice culture. Dr. Vasquez, like Dr. Everett, was missing some information on her patient. She approached staff members with a pleasant expression and respect for the work they were performing. She requested assistance and demonstrated her appreciation to her staff. Dr. Vasquez clearly projected a cooperative attitude of teamwork. Although Mr. Benson is angry due to the longer than anticipated wait, in reality his anger may be the result of the anxiety he feels about his own health needs or that of his wife's. To wait such a long time is bad enough for the patient, but the receptionist's behavior only made Mr. Benson more upset. Clearly, Barbara was frustrated by the hectic schedule, but once she became aware of the situation, Barbara might have focused on Mr. Benson, but instead she appeared to want to move past his concerns as quickly as possible. Okay, 15 more minutes have passed now. Observe how Alice handles this one. It is important to understand that there are some circumstances that will cause patients and their family members to become unhappy and even angry, and there's nothing that can be done to satisfy them. In the scene with Mr. Benson, Alice did everything she could to help Mr. Benson overcome his anger. She focused her attention on Mr. Benson and listened as he explained his concerns. She remained calm and used a calming tone of voice as she apologized for the delay and explained the policy of the practice and of Dr. Vasquez's personal commitment to her patients. Alice then went into action by calling the medical assistant to determine how much longer the wait would be. She informed Mr. Benson and again apologized for the wait. The truth is that there are some patients that you cannot please, but you must do all in your power to meet their expectations. It is important for Alice not to internalize Mr. Benson's anger, not to take it personally. If she takes Mr. Benson's anger personally, it will interfere with her ability to provide excellent care and service to her other patients. Apologize, acknowledge their problem, recognize its validity and the feelings involved. Give clear explanation, but not excuses. Offer to give help, and finally request that they return to the waiting area. Out-processing a patient can make a strong positive or negative impression. Barbara clearly performed her technical task. She quickly scanned the encounter form and noted that there was a $10 copay. She informed Mr. Franklin and collected the money. But she did not personalize the encounter, nor did she offer a pleasant comment as the patient and his granddaughter prepared to leave. Next, let's see how Alice assists Mrs. Cooper. Once again, Alice projected a friendly image. She used the out-processing both to book a return visit and as an opportunity to state the practice policy on changing or canceling appointments. Again, she used Mrs. Cooper's name repeatedly, which personalized the conversation, and her facial expressions and tone of voice conveyed her interest in Mrs. Cooper. I want to thank you for participating in this educational program. I hope you've been able to use this program as an opportunity to review your personal communication style and to incorporate some of these communication pearls to enhance what you do so well. Provide great care for your patients and their family members every day.